Hi, my name is Felia Babylon. I'll be your nurse today. So how are you?
Hi, Billy. I'm good, thank you. How are you?
I'm doing wonderful. Can you state your name and your date of birth?
Sure. My name is Sina Chun. My date of birth is July 9, 1960.
Thank you. And who is with you today?
My brother, Mohammed, he's here.
I'm
Hey,
happy to Hello, I'm happy to meet you both. So is it okay while I discuss your diagnosis today and your teaching plan that Dr. Hopkins and our staff recommend for you to do at home?
Yes.
yes,
Great.
I will support my sister to make her feel better.
Wonderful. So do you have any question before I start?
No.
No,
Okay, so first you need to acknowledge and have an understanding of heart failure signs and symptoms because heart acts as a pump in our body which pumps blood to all organs, and heart failure means if the pump fails, almost all organs will be affected. And the common signs and symptoms are difficulty breathing, chest pain, fatigue, weakness, dizziness, and edema. And the second is management of healthy diet modification, wherein you will cook with less salt, low fat or fat-free dairy foods, and using more fiber. And you have to limit fluid intake to no more than 6 to 8 cups per day, especially at night. And you have to eat fresh fruits and vegetables whenever possible. And the third is management of lifestyle changes, when you have to avoid strenuous activities, but you have to do 30 to 45 minutes of exercise 3 to 4 times per week. And if you are smoking, you have to stop and limit alcohol intake. And you have to take your medications as directed by your doctor. Do you have any questions so far?
I have question. Is I have any training the symptom that you mentioned about? So should I call you right away, or should I go to the clinic that close to my house?
If those symptoms becomes worse, contact 911 immediately or go to the nearest emergency.
Okay, thank you.
and during this pandemic, we are all staying home. So could you please give me some recommendations which I can help my sister to manage her heart failure?
Yes, I encourage you both, Sina and you, to join a local support network such as cardiac rehabilitation because they can help you to reduce your anxiety and fear and also help you regain your strength. And they will also they have a book which guides and improves your success of recovery. And I will provide more information about this book to you and Sina after we finish learning.
Okay, thank you. And what about her activities? Could we expect that she will return to a normal life without any medication?
Thank you, Muhammad, for a great question, but the answer is no, because heart failure is a chronic condition that will progress during the time. So the patient has to use her medications to minimize progression of the disease. Moreover, rehabilitation is an important part of the management that will increase her quality of life.
Thank you.
You're welcome. So I will ask you some questions which help you to reflect on both your learning today. Is it okay?
Yes.
Yes.
Great. So can you tell me what is the healthy diet for a heart failure?
So I will when I cook, I'm gonna use less salt, and I will eat the fresh food and vegetable as well.
Great. And can you tell me how many cups of fluid intake that you need to drink per day?
I will drink 6 to 8 cups per day.
Thank you, Sina. So I will show you some images that we've talked about today. Okay?
Okay.
Okay, so I'm preparing the images. And the first one is a picture of the low sodium. These are the foods. They're the foods with low sodium that you will incorporate in your diet. And the next one is about the medication list. Okay, so that's the one that you will get from your prescription from your doctor. Okay, so I will email you both all the signs and symptoms and the teaching plan, as well as the list of the medication that you need to take and the cardiac rehabilitation link. But if you experience signs and symptoms and is getting worse, please call 911 or go to the nearest emergency.
Thank you.
Okay, thank you, Philly.
You're welcome, and thank you both for your time. Have a nice day.
You too. Bye.